Hi, it's Dr. Zunaid from Elite Aesthetics. Today we're talking about a wonderful product that we offer at the clinic called the Perfect Peel. As we're approaching autumn, it's an excellent opportunity for patients to be engaging in skin resurfacing treatments, and the Perfect Peel is a really good example of that. So it is quite a unique product. It's medical grade only, and it is usually administered by a trained doctor. The reason for that is the number of acids that it has in its blend is quite unique, and it is quite strong. So from the start, I would say that the most commonly asked question is, how many layers of skin is it going to remove? And it is a medium to a deep depth peel. And to give you an idea of some of the acids that are in it, it contains TCA, which is trichloroacetic acid, which is a medium depth acid that helps to rejuvenate the upper layers of the dermis and the lower layers of the epidermis. It also contains salicylic acid, which is a keratinolytic, which will help the skin to turn over. It also has anti-inflammatory properties, so it's very, very good for patients who have acne. It has retinoic acid in it, which is a derivative of vitamin A. So your fine lines, your wrinkles, your open pores, and your textural problems will be addressed by the retinoic acid within the Perfect Peel. It has a unique ingredient in it, which is a skin brightening agent. It's not a skin bleacher, it's a natural antioxidant that occurs in our body, and that's called glutathione. It also has one of the ultimate skin brightening alpha hydroxy acids in it called kojic acid. It has a little bit of phenol, which gives it that additional kick. It has some vitamin C, which is a natural skin brightener, and it has some minerals in its formulation. So when you come into clinic, you will have the peel, which is this vial, which is one per patient, and it's usually enough to cover face and neck. We make sure that when we are applying this, we apply to completion in order to get the maximum benefit from the treatment. On leaving clinic, you'll be supplied with a home kit. The home kit has got 2 retinol acid towels that you will use on day 1 and day 2 on your face, and it also has a moisturizer in it that contains vitamin C that you will use for the days of the peeling. So a common question that we have whenever we do any kind of chemical skin resurfacing or chemical skin biorevitalization is, what is the downtime? So with the Perfect Peel, the peeling for most patients, and for most patients I mean 9 out of 10 patients, will start on day 3 and will generally continue to about day 7 or day 8. So you're looking at about 4 days of intense high-grade peeling, at which point we encourage patients to use a lot of moisturizer to help those layers of the epidermis to lift and to slough off. The results that we get from the Perfect Peel are absolutely exceptional. Understandably, there's some patients who cannot afford to have the downtime or those days off work or those days to be indoors. However, with the large amount of people who are now working from home during this difficult period, we find that it might be a good opportunity for you to get your skin resurfacing treatments done. Any comments, any queries that you may have, please feel free to contact us at Elite.